Bismillahirrahmanirrahim. My name is Ahmed Shawky, lecturer of Diagnostic and Interventional Radiology at University. I would like to discuss differential diagnosis of hepatic focal lesions by CT and MRI. Generally, hepatic focal lesion can be divided into benign and malignant lesions. Benign lesion could be cyst or solid lesion. Liver cysts like simple cyst, traumatic cyst, hydatid cyst, pyeloma, Caroli disease, biliary cyst adenoma, and liver abscess. Benign solid lesion like hemangioma, nodular hyperplasia, hepatic adenoma, regenerative nodule, dysplastic nodule, and biliary hamartomas. Malignant lesions include metastasis, solid or cystic metastasis, hepatocellular carcinoma, intrahepatic cholangiocarcinoma, and lymphoma. Liver cysts appear as well-defined lesions of low signal in T1 weighted images and of bright signal in T2 weighted images. And in CT, it appears as low attenuation lesion with house field from 0 to 10 house field units. It don't enhance in post-contrast study. Identity cyst appears like the previous cyst, but it shows daughter cyst inside, also show floating membrane inside, giving the water lily sign. The wall and septum may enhance in post-contrast study. Caroli disease show multiple variable size cysts communicating with the biliary system. In post-contrast study may show central dot sign. This is the enhancing the hepatic radical, portal radical. Hepatic abscess show a well-defined thick walled lesion. It show peripheral or marginal enhancement in post-contrast study with restricted diffusion in diffusion-weighted images. Hemangioma. Hemangioma is following the blood pool. As you see, this lesion is a hemangioma. It follows the blood pool. Here is the blood in the pre-contrast study. Here is arterial phase, portal and delayed phase. Show peripheral nodular enhancement and it's the same attenuation as like the blood vessel. Giant hemangioma usually not completely enhanced. It shows peripheral nodular enhancement but leaving central scar, not enhancing central zone. Small size hemangioma it hangs completely from the start. It's called flash hemangioma. Focal nodular hyperplasia show central scar. It is an benign tumor within the liver, and it completely enhanced in the arterial phase. The central scar usually enhanced in the delayed images. The most characteristic regarding the scar is the bright signal in T2 weighted images. This is another lesion showing central scar with post-contrast enhancement without scar enhancement, and in the delayed image there is a scar enhancement. Here is the scar with T2, bright T2 pigment. The main differential diagnosis of is fibrolamellar carcinoma. It shows also a central scar, but the main difference in the scar is of low to T2 signal, and the scar usually does enhance, and it may show calcification. The lesion itself, regarding the fibrolamellar hyperplasia, it shows homogeneous enhancement, but in fibrolamellar carcinoma, heterogeneous enhancement. Hepatic adenoma, we usually need a history like oral contraceptive pills, glycogen storage disease. This is hepatic adenoma showing this area of bleeding, hemorrhage. Also, it may show areas of lipid deposition. Here is in phase and out of phase MRI images. This is another hepatic adenoma showing hemorrhage inside. Multiple biliary hamartoma. It look like Caroli disease, but the main difference, these lesions don't communicate with the biliary system. Show multiple high T2 signal lesion, innumerable T2 hyperintense cystic lesion in both liver loop don't communicate with the biliary tract. Regenerative nodule is a benign nodule. It shows low signal in T2 weighted images and don't enhance in post-contrast stuff. Dysplastic nodule also show a high T2 signal, which is a little bit malignant criteria, but don't enhance in post-contrast study. This differentiates the regenerative nodule from dysplastic nodule from HCC. HCC usually of high T2 signal in MRI study, and it shows the characteristic enhancement, which is arterial enhancement with rapid wash out in the portal phase. Here is a lesion, show arterial enhancement and wash out in the delayed image. Here is a lesion showing wash out in the portal phase. This lesion in the same level. Here is the right hepatic lobe lesion, and here is left hepatic lobe lesion. The main difference is wash out. Here, no, I cannot discriminate the lesion. Here, the lesion is still obvious. So it is hemangioma, but this is HCC. Here's another example showing high T2 lesion, which is malignant criteria, okay, and the T1 of low signal. In both the contrasted arterial phase show enhancement and wash out in delayed phase with corona sign or peripheral or capsular enhancement in delayed phase. There is two hepatic focal lesions. In T2 weighted image, the most obvious is low signal lesion, it is a regenerative nodule. It is a high signal lesion, it is HCC. Hepatic metastasis could be cystic or solid, also could be hypovascular or hypervascular. There is there is a hypovascular metastasis. It shows enhancement but it delayed images. Okay, there is multiple hepatic metastasis showing hypervascularity. It enhanced in the arterial phase. Hypovascular metastases like from the colon, lung, prostate, gastric, and transitional cell carcinoma. Hypervascular lesion like islet cell tumor, breast cancer, melanoma, and thyroid cancer, and also carcinoid tumor. Intrahepatic cholangiocarcinoma, the most characteristic regarding this lesion is an infiltrative mass with capsular retraction. With infiltrative mass with capsular retraction, it shows persistent enhancement in the delayed image. In the early arterial phase and in the portal phase show minimal enhancement, but in the delayed image it shows enhancement, marked enhancement. This is more characteristic regarding cholangiocarcinoma. Thank you.